If you're watching this video, you or a loved one may be preparing for histotripsy, a non-invasive FDA-approved treatment for liver tumors, including both primary liver cancer and metastatic disease. Let's walk through what histotripsy is, how it works, and exactly what to expect before, during, and after your procedure. Histotripsy is a non-invasive, FDA-approved treatment that uses focused sound waves to destroy tumors in the liver, without incisions, radiation, or needles. It works by generating precise pulses of ultrasound energy that create tiny bubbles inside the tumor. These bubbles rapidly expand and collapse, breaking apart the targeted cancer cells with surgical precision, while leaving healthy tissue around them untouched. This process is guided in real time by diagnostic ultrasound, allowing us to target the tumor accurately and safely. A treatment head, similar to a large ultrasound probe, is placed on your abdomen inside a soft, water-filled membrane. This helps transmit the sound waves efficiently into the liver. Once the tumor is identified on ultrasound, the focused sound energy is activated, creating what we call a bubble cloud that selectively destroys the tumor tissue. The procedure is done under general anesthesia. You'll be asleep the entire time and won't feel anything during the treatment. In the days and weeks leading up to your histotripsy treatment, your care team will walk you through a few important steps. You will need blood work and possibly an EKG, depending on your overall health. The day before your procedure, you'll have an abdominal ultrasound at the hospital to help guide treatment planning. If your tumor is in a specific location in the liver, you may have been given a bowel prep protocol. Be sure to follow the instructions carefully. This is essential for accurate targeting. If you've had prior biliary procedures, such as an ERCP, biliary stent placement, or Whipple procedure, you'll likely be prescribed antibiotics, starting 3 days before your procedure and continuing for 3 weeks. Not all patients need antibiotics. Your doctor will let you know if this applies to you. You must be NPO, nothing by mouth, starting at midnight the night before your procedure. That includes food, drink, and water. It's important to note, you must be physically fit to travel by plane in order to undergo histotripsy. If you have advanced symptoms, severe liver dysfunction, or are not medically stable for air travel, this procedure may not be appropriate. Our team will help assess this during your initial evaluation. When you arrive at the hospital, you'll meet your care team, including the doctor performing the procedure. You'll review any final questions and then be taken to the treatment suite. Histotripsy is performed under general anesthesia, so you'll be asleep and completely comfortable throughout. The procedure typically lasts between 1 to 3 hours, depending on the number and size of the tumors being treated. There are no incisions, which means no surgical wounds, no stitches, and minimal risk of bleeding or infection. A CT or MRI scan will be performed after the procedure on the same day to ensure the targeted area was successfully treated. After your procedure, you'll recover for about 2 hours in the recovery area. This is an outpatient procedure, and most go home or back to their hotel the same day, but you must have someone available to drive you to and from the hospital. In the first 12 to 24 hours after general anesthesia, your balance and coordination may be affected. You should avoid driving, operating machinery, or making important decisions during this time. It's normal to experience low-grade fever, mild flu-like symptoms, abdominal pain, skin redness, or tenderness at the treatment site. These usually resolve within a few days. You may take Tylenol or Advil for pain relief unless told otherwise by your care team. You may resume a normal diet after the procedure unless instructed otherwise. However, it's important to contact your doctor or go to the nearest emergency room if you experience any of the following: severe pain, not controlled with prescribed pain medications, persistent numbness, tingling, or significant weakness. Fever over 101 degrees Fahrenheit, flu-like symptoms lasting more than 7 days, jaundice or yellowing of the skin or eyes. If jaundice occurs, seek immediate medical attention or call 911. We understand that many of our patients travel for treatment. Our team will help coordinate transportation to and from the hospital and assist with lodging recommendations, so your experience is as smooth as possible. Let's clear up a few misconceptions. Histotripsy does not make cancer spread. In fact, studies suggest it may stimulate the immune system to recognize and fight cancer in other parts of the body, but this effect occurs only in some patients and is not guaranteed. You can continue systemic therapies, such as chemotherapy or immunotherapy, without interruption. Histotripsy does not interfere with ongoing cancer treatments. Most patients need only one histotripsy session. However, if you have multiple liver lesions or a larger tumor, you may need a second or third treatment. These are typically spaced 6 to 8 weeks apart, and your care team will plan this with you in advance. Histotripsy is FDA approved, and recent US and European studies from the Hope for Liver trials have shown it to be a safe and effective option for treating liver tumors. Risks are minimal and rare. About 5% of patients may experience side effects, including skin blistering, portal vein thrombosis, or temporary decline in kidney function. Some patients with advanced liver disease may experience worsening liver function after the procedure, usually due to progression of their underlying cancer, not the treatment itself. There's negligible risk of bleeding, and infection is very unlikely unless you've had previous biliary interventions. Histotripsy offers a powerful, incision-free option to treat liver tumors with precision, minimal downtime, and a low complication rate. If you've been scheduled for this treatment, know that you're in expert hands. We'll guide you through each step and support you from pre-op to recovery. If you have questions, your care team will review everything with you again before your procedure. We look forward to helping you through this next phase of treatment.